Question is on the motion to table the ruling of the chair, and the clerk will call the roll. All those in favor say aye. Those opposed,
Aye.
no. The chair believes that the ayes have it, so repeating that segment, and now we will proceed to a roll call.
Mr. Doggett?
Doggett votes aye.
Mr. Doggett votes aye. Mr. Thompson?
Thompson, aye.
Mr. Thompson votes aye. Mr. Larson?
Yes.
Mr. Larson votes yes. Mr. Blumenauer?
Blumenauer, aye.
Mr. Blumenauer votes aye. Mr. Kind?
Kind, aye.
Mr. Kind votes aye. Mr. Pascrell? Mr. Pascrell votes yes. Mr. Davis?
Davis votes aye.
Mr. Davis votes aye. Ms. Sanchez? Ms. Sanchez votes aye. Mr. Higgins?
Higgins, yes.
Mr. Higgins votes yes. Ms. Sewell?
Sewell votes yes.
Ms. Sewell votes yes. Ms. Dalbene? Aye. Ms. Dalbene votes aye. Ms. Chu?
Chu votes aye.
Ms. Chu votes aye. Ms. Moore?
Moore votes aye.
Ms. Moore votes aye. Mr. Kildee? Kildee votes aye. Mr. Kildee votes aye. Mr. Boyle?
Boyle votes aye.
Mr. Boyle votes aye. Mr. Byer?
Byer votes aye.
Mr. Byer votes aye. Mr. Evans? Mr. Evans votes aye. Mr. Schneider?
Schneider votes aye.
Mr. Schneider votes aye. Mr. Swazi?
Swazi, aye.
Mr. Swazi votes aye. Mr. Panetta? Mr. Panetta votes aye. Ms. Murphy?
Murphy votes aye.
Ms. Murphy votes aye. Mr. Gomez? Mr. Gomez votes aye. Mr. Horsford? Mr. Horsford votes aye. Ms. Plaskett?
Plaskett votes aye.
Ms. Plaskett votes aye. Mr. Brady?
No.
Mr. Brady votes no. Mr. Nunez?
Nunes votes no.
Mr. Nunez votes no. Mr. Buchanan?
No.
Mr. Buchanan votes no. Mr. Smith of Nebraska?
Smith of Nebraska votes no.
Mr. Smith of Nebraska votes no. Mr. Reed?
Reed votes no.
Mr. Reed votes no. Mr. Kelly? Mr. Kelly votes no. Mr. Smith of Missouri? Mr. Smith of Missouri votes no. Mr. Rice? Mr. Rice votes no. Mr. Schweikert? Mr. Schweikert votes no. Ms. Walorski? Ms. Walorski votes no. Mr. LaHood?
No.
Mr. LaHood votes no. Dr. Wenstrup?
No.
Dr. Wenstrup votes no. Mr. Arrington?
No.
Mr. Arrington votes no. Dr. Ferguson? Dr. Ferguson votes no. Mr. Estes? Mr. Estes votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Hearn?
No.
Mr. Hearn votes no. Mrs. Miller?
No.
Mrs. Miller votes no. Mr. Chairman?
Aye.
Mr. Chairman votes aye.
The clerk will report the tally.
Mr. Chairman, I have 25 yeses and 18 noes.
25 ayes and 18 noes. The ruling of the chair is sustained. Are there any amendments to the amendment in the nature of a substitute? If there are no amendments, the question is on the adoption of the amendment in the nature of a substitute. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the ayes have it. The amendment in the nature of a substitute is agreed to. Now let me recognize Mr. Thompson for the purpose of offering a motion.
Mr. Chairman, I move that the committee favorably report Part 2 of Subtitle E, Budget Reconciliation Legislative Recommendations relating to elder justice as amended to the Committee on Budget.
The question is on transmitting Part 2 of Subtitle E as amended to the House Committee on the Budget. Members are reminded to unmute themselves for the voice vote. All those in favor signify by saying aye.
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 Those opposed, no. In the opinion of the chair, the ayes have it. The motion is
Mr.
agreed
Chairman,
to.
I ask for a record vote.
As amended in order to be transmitted to the House Committee on the Budget, and the gentleman requests a recorded vote.
Correct.
The clerk will please call the roll.
Mr. Doggett?
Doggett votes aye.
Mr. Doggett votes aye. Mr. Thompson?
Thompson, aye.
Mr. Thompson votes aye. Mr. Larson?
Yes.
Mr. Larson votes yes. Mr. Blumenauer?
Blumenauer votes yes.
Mr. Blumenauer votes yes. Mr. Kind?
Kind, aye.
Mr. Kind votes aye. Mr. Pascrell?
I vote yes.
Mr. Pascrell votes yes. Mr. Davis?
Davis votes aye.
Mr. Davis votes aye. Ms. Sanchez?
Sanchez votes aye.
Ms. Sanchez votes aye. Mr. Higgins?
Higgins, yes.
Mr. Higgins votes yes. Ms. Sewell?
Sewell votes aye.
Ms. Sewell votes aye. Ms. Dalbene? Aye. Ms. Del Bene votes aye. Ms. Chu?
Chu votes aye.
Ms. Chu votes aye. Ms. Moore?
Moore votes aye.
Ms. Moore votes aye. Mr. Kildy?
Kildee votes aye.
Mr. Kildy votes aye. Mr. Boyle?
Boyle, aye.
Mr. Boyle votes aye. Mr. Byer? Mr. Byer votes aye. Mr. Evans? Mr. Evans votes aye. Mr. Schneider?
Schneider votes aye.
Mr. Schneider votes aye. Mr. Swazi?
Swazi, aye.
Mr. Swazi votes aye. Mr. Panetta? Mr. Panetta votes aye. Ms. Murphy?
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez? Mr. Gomez votes aye. Mr. Horsford? Mr. Horsford votes aye. Ms. Plaskett?
Plaskett votes aye.
Ms. Plaskett votes aye. Mr. Brady? Mr. Brady votes no. Mr. Nunez?
Nunes votes no.
Mr. Nunez votes no. Mr. Smith of Nebraska?
No.
Mr. Smith of Nebraska votes no. Mr. Buchanan? Mr. Buchanan?
Votes no.
Mr. Buchanan votes no. Mr. Reed?
Reed votes no.
Mr. Reed votes no. Mr. Kelly? Mr. Kelly votes no. Mr. Smith of Missouri? Mr. Smith of Missouri votes no. Mr. Rice? Mr. Rice votes no. Mr. Schweikert? Mr. Schweikert votes no. Ms. Walorski? Ms. Walorski votes no. Mr. LaHood?
No.
Mr. LaHood votes no. Dr. Wenstrup? Dr. Wenstrup votes no. Mr. Arrington?
No.
Mr. Arrington votes no. Dr. Ferguson? Dr. Ferguson votes no. Mr. Estes? Mr. Estes votes no. Mr. Smucker? Mr. Smucker votes no. Mr. Hearn? Mr. Hearn? Mrs. Miller?
No.
Mrs. Miller votes no. Mr. Hearn? Mr. Chairman?
Aye.
Mr. Chairman votes aye.
The clerk will report the tally.
Mr. Chairman, I have 24 ayes and 18 noes.
There being 24 ayes and 18 noes, the motion is agreed. Part 2 of Subtitle E is amended, and it is ordered transmitted to the House Committee on the Budget. Without objection, staff are authorized to make technical and conforming changes to the committee print, and members have 2 additional days to file with the committee clerk supplemental, additional, dissenting, or minority views. Our next order of business is Part 3 of Subtitle E, the budget reconciliation legislative recommendations related to skilled nursing home services. Let me recognize the gentleman from New Jersey, Mr. Pasquale, for the purpose of offering an opening statement.
No.
Thank you, Mr. Chairman. Our nursing home population has been disproportionately devastated by the COVID. While nursing facility residents are particularly vulnerable to COVID-19, there were existing gaps and deficiencies that went unaddressed before COVID. To deny this is to deny reality. There is no single solution to the myriad of problems that COVID-19 exposed. And I use the word exposed non-reservedly. It's a good reflection of what we faced in the COVID. Who was most vulnerable? Who was more apt? So there's no single solution to the myriad of problems, but significant improvements to staffing and oversight, along with better data systems and transparency, would increase quality and safety for residents and staff. The COVID-19 pandemic underscored the important relationship between sufficient staffing and the safety of nursing homes and their residents. Understaffed facilities are 2 times more likely to have COVID-19 resident infections than comparable facilities with higher staffing levels. For years, researchers have linked low staffing levels to poor quality and patient safety violations. This provision addresses the unreliable and confusing ways we track and improve safety in nursing homes. It will ensure payment adequacy and that residents receive the best possible quality of care. They deserve nothing less. These common sense and long overdue investments will direct vital resources to these settings, which have become such sources of heartbreak and loss over the last 2 years. There's not one of us who hasn't experienced it, not only in our districts, but other districts in our state. This is an unprecedented investment in nursing home care. It fills a much-needed gap in transparency, community, accountability, quality of care, and staffing. Nursing homes will now be better prepared to face future public health emergencies. This is not the time to let our foot off the gas in fighting for our seniors and people with disabilities that reside in nursing homes. Patients and staff deserve more, Mr. Chairman. And Mr. Chairman, I'm talking about not only those homes that have been controlled by the equity firms, I'm talking about homes across the country, regardless of who owns it, private, public, whatever. And we need to do something about it firmly to show all of us are concerned and doing something about it rather than crying in our beer. It's all yours, Mr. Chairman.
Let me recognize the gentleman from California, Mr. Nunez, for the purposes of an opening statement.
Thank you, Mr. Chairman. I'll be very brief. We could have worked on a bipartisan basis to improve reporting at skilled nursing homes. In fact, during this pandemic, House Republicans have continually raised concerns states like New York and Pennsylvania systematically reported false information about COVID-related nursing home deaths, not only to families who have lost loved ones in their state, but to the rest of the country. They have engaged in this cover-up for partisan political purposes. The provisions before us today would advance our shared goal to ensure information from nursing homes is reported accurately and that the federal government holds states accountable for any inaccuracies. I wish my colleagues on the other side of the aisle had held governors in their home states to the same standard from the pandemic's outset. We will give them that opportunity today. And with that, Mr. Chairman, I look forward to the amendments. Yield back.
The committee will now proceed to consideration of Part 3, Subtitle E. And without objection, the measure will be considered as read and open for amendment at any point. At this time, I offer an amendment in the nature of a substitute, which was distributed in advance along with the green sheet explaining it. Without objection, the amendment in the nature of a substitute shall be considered as read, open for amendment at any point, and considered base text for the purpose of amendment. Let me now turn to Amy Hall, the Staff Director for the Subcommittee on Health, to provide the technical description of the amendment in the nature of a substitute with an emphasis on changes made since introduction. I ask that members hold their questions until after her presentation.
Thank you, Chairman Neal. Budget reconciliation legislative recommendations for Subtitle E relating to skilled nursing facilities builds on the work of the committee relating to improving patient safety and quality of care in nursing facilities, including 3 hearings over the past number of years. Section 13402, funding to improve accuracy and reliability of certain skilled nursing facility data, would amend Section 1888 of the Social Security Act, H-12, to expand the data validation process to the skilled nursing facility value-based purchasing and minimum data set measures. Section 134202, ensuring accurate information on cost reports, would amend Section 1888F of the Social Security Act to provide funding for the Centers for Medicare and Medicaid Services to audit skilled nursing facility cost reports. Section 134203, survey improvements. This adds a new L to Section 1819 of the Social Security Act, providing enhanced funding for survey improvements, including training, tools, and technical assistance for surveyors to improve the survey process. Section 134204, nurse staffing requirements, would amend Section 1819D of the Social Security Act to provide funding for a study by the Centers for Medicare and Medicaid Services, beginning no later than 3 years after the date of enactment of this act, and not less frequently than every 5 years thereafter, on minimum staff-to-resident ratios for nursing staff for skilled nursing facilities, including registered nurses, licensed practical nurses, and other categories to optimize patient care. Based on this study, the Secretary shall update regulations for minimum staffing ratios. The amendment in the nature of a substitute on page 3, line 14, strikes if, inserts of. On page 6, line 9, strikes 1 and inserts 2. Page 6, line 16, again, same edit, strikes 1, inserts 2. And page 8, line 24, inserts, in addition to the authority to waive the application of clause 1i to under section 1135. That concludes my walkthrough. I am more than happy to answer any questions.
Thank you, Ms. Hall. Are there any questions about the amendment in the nature of a substitute? Is there anyone who wishes to strike the last word?
I have a question, Mr. Chairman. I'm sorry.
The gentleman from South Carolina is recognized to ask a question and/or to strike the last word simultaneously.
Is this subsection, does it provide a grant program? Does it provide any grant program?
No, there's no grant program. The funding, so there are I think 4 pieces here that have funding, and it provides administrative funding for the Centers for Medicare and Medicaid Services to undertake these activities. So, for example, auditing cost reports is a very labor-intensive activity. It provides funding to the Centers for Medicare and Medicaid Services for that purpose. As you know, survey and certification, these are the people that go out and help nursing homes, make sure they're treating patients and help them improve, and they come back and check on them and that sort of thing. So there's additional money for that activity, as well as some standardization and organization of the survey process, because, there are really 50 different survey processes across, with all the states. So to try to make that, help the surveyors improve their survey activities.
Thank you. I yield back.
The gentleman is yielded back. Are there other, we're in the process of strike the last word. Is there anybody who wishes to strike the last? Mr. Doggett is recognized.
Thank you, Mr. Chairman. Just over 18 months ago, the first major COVID outbreak in the United States occurred in a nursing home out in Washington State. Despite the earliest of warnings that nursing homes were highly susceptible to this virus, no meaningful action was taken in response by the Trump administration, which showed the same indifference and irresponsibility that it has to so many other aspects of the pandemic. But he had taken action that made a big difference before the pandemic ever began. In 2016, President Obama proposed regulations that every nursing home would have someone designated as an infection control specialist. President Trump suspended that indefinitely. Think what good it would have done if each of our nursing homes had had that infection control specialist. There are serious problems with staffing in America's nursing homes, and many patients, many residents face neglect as a result of those inadequate standards. Unfortunately, this measure only proposes to do a study. I think it's clear that the idea of a study and regulations which might take 5 years would not prevent the type of infection control specialist regulation that President Obama recommended, and indeed I'm hopeful that CMS will put in place all of the regulations that President Obama recommended and which President Trump suspended or postponed. We know that the General Accountability Office 3 years ago found that of nursing home facilities around the country, a significant understaffing. Only about 1 in 4 facilities across America met the nursing hours per resident per day recommended by CMS long ago. We get a study out of this. I think it's important that it not lead to delay in action on staffing. And I see little harm otherwise from doing it, but also not the kind of effective response that I would like to have seen growing out of the hearing that our Health Subcommittee had last year about the need for better staffing in our nursing homes. And with that, I yield back.
I thank the gentleman. Is there anyone else who wishes to strike the last word? We are prepared to move to the amendment stage. Are there any amendments to the amendment in the nature of a substitute?
Mr. Chairman, I have an amendment at the desk.
The gentleman from Pennsylvania, Mr. Schmucker,
Mr.
is
Chairman.
recognized.
Mr. Chairman,
Mr. Thompson.
I reserve a point of order.
Mr. Thompson has reserved a point of order. The gentleman, as we pass out the amendment, will be prepared to be recognized. The gentleman is recognized on his amendment.
Thank you, Mr. Chairman, and I plead for the majority's consideration for the request in this amendment. Mr. Pascrell's discussion about concerns with care at nursing homes could very well have made the case for this amendment. In our case, people have died due to decisions that were made around the care in nursing homes, and we've been unable to get adequate information that the loved ones who have lost family members are looking for and continue to look for. We've previously asked for this information from the committee, and I ask today, I beg of you to take seriously this request. I'm talking about what was brought up before, under the leadership of Governor Tom Wolf, the Pennsylvania Department of Health followed Cuomo, the disgraced New York Governor Cuomo's lead, and adopted a policy during the pandemic that required nursing homes to admit COVID-positive patients. That fatal decision, made in only a few states, led COVID-19 to spread throughout Pennsylvania nursing homes like wildfire. And as a result, Pennsylvania ranks second in the nation in the number of COVID-19 deaths in long-term care facilities, with residents and staff accounting for more than half of all COVID deaths in the Commonwealth of Pennsylvania. In the district that I live, nearly 70%, tragically, of the deaths that occurred due to COVID occurred in nursing homes. Governor Wolf's failure to protect seniors didn't start with exposing nursing home residents and their staff to COVID-19, by the way. The governor and former Pennsylvania Department of Health Secretary Rachel Levine have a long track record of providing poor oversight of nursing homes even before the pandemic began. Pennsylvania lagged the nation in completing required annual survey inspections and infection control reviews. And as a result, Governor Wolf ignored that some facilities may be more susceptible to rapid transmission of the virus. Nursing homes with a pattern history of infection control deficiencies were left to fend for themselves as they grappled with the rising COVID caseloads. Facilities pleaded with Secretary Levine to prioritize them for PPE disbursements, help with testing and staffing shortages, but she responded, get this, Secretary Levine responded by removing her own mother from a nursing home. President Biden went on to reward her decisions by appointing her as the Assistant Secretary for Health at the U.S. Department of Health and Human Services. Our nation has many lessons to learn from the pandemic. There are many actions that we can take in the future to better protect the most vulnerable, but step one on the path to improvement is to have complete and accurate data. Yet there's a Spotlight PA report from September 2020 revealed that the PA Department of Health has consistently misreported death and case data for the state's nursing homes. Adding to the confusion, just yesterday, McKnight's Long-Term Care News published a story breaking the news that more than 16,000 COVID-19 deaths in nursing homes were omitted from federal data. And Mr. Chairman, I'd like to submit both of those articles for the record.
So ordered.
Thousands of families in Pennsylvania and across the nation lost loved ones in nursing homes. In fact, a personal friend of ours lost a family member when her roommate in a nursing home got sick, was taken to the hospital, and was required to come back when she had COVID. And our family friend, the friend of the family, A member of the family died shortly after. This amendment, by the way, is named for a Mr. Mazirik, who lives in Tom Reed's district, Representative Reed, who never got to see his loved ones like so many others before they died in nursing homes. Folks, our constituents deserve answers, and at the very least, accurate reporting. This amendment simply instructs the Secretary of Health and Human Services to certify to Congress that the number of deaths of residents in skilled nursing homes match the publicly reported number in each state. Asking for that data, asking for complete data to understand the full impact of the pandemic within long-term care facilities should not be asking for much. We shouldn't even be in a position where we have to ask for this. Accurate data will help instruct future measures that can be taken to strengthen protections going forward. So I urge my colleagues to support this common sense measure.
Is the gentleman?
I yield back.
Okay, so, Mr. Smucker, the staff thinks that there could be some merit to your amendment. So if you were prepared to withdraw it, I would revisit it for you.
Mr. Chairman, I've asked for this before. I think now is the time to make this decision. This could easily be added to this bill at this time.
This would hold up all the survey money to a state based on a secret secretarial certification. So I see there is an interest in public reporting, but I would welcome working with you on this going forward, but I won't support it at the moment. So if the gentleman would like a roll call vote, we can proceed.
I
Mr.
remove
Thompson's
my
withdrawn
point, I
his
remove my
order.
point of order. Withdraw my point of order.
Mr. Kelly would like to be heard as well. Okay, fair
I
enough.
think we have another speaker, but yes, I do ask for a vote on this today.
Fair enough.
Mr. Chairman.
Okay, Mr. Kelly.
Yeah, Mr. Chairman, thank you. Mr. Smucker referenced a colleague or a constituent of Mr. Reed's. Mr. Reed can't be here to speak on this, but I just wanted to emphasize Albert Mazorik is more than just a statistic. He was a lifelong resident of Chautauqua County. He was a devout Catholic, an avid Bills fan, a NASCAR enthusiast, and an outdoorsman. He was deeply loved by his family, and those who knew him could tell you he was one of the kindest people you could ever meet. When New York was sending COVID-positive patients into nursing homes, Albert was a resident of one of these facilities. Unfortunately, Albert became one of thousands who contracted COVID in a New York nursing home and passed away alone and not having seen his family in nearly a year. And Albert will never be forgotten. I just want to reference, this is from the Journal of the American Medical Association. It said the omissions resulted in severe underreporting by the National Healthcare Safety Network and could have impacted the federal government's response to providers most in need during the first months of the pandemic. That's what researchers say. And I think it comes down to we collect data, we try to analyze data, and then we don't bring the data into the conversation. It just doesn't make any sense to me, and I think Mr. Smucker, Mr. Reed, and myself have a valid request on this amendment. And I would just like to suggest that, going forward, there's an old saying that there's no secrets in our family. There's just a lot of things we don't talk about. This is horrible what happened. This could have been prevented. But because we weren't willing to reveal the data, we pushed it away. I feel like Mr. Pascrell does. There's not anybody in here who doesn't want to see the data, does not want to analyze the data, and does not want to come up with an informed opinion of what it is that we're trying to get to. So with that, Mr. Chairman, I yield back, but I want to make sure that everybody remembers tonight the name Albert Mazorik and the fact that he was the victim of a governor who made him stay in a nursing home when he could have gone someplace else, and he died by himself when he could have been surrounded by a loving family. That's not a tragedy, that's a crime.
I thank the gentleman. So the question then before us is on the gentleman's amendment. All those in favor signify by saying aye.
Aye. Aye.
Those opposed, no. No. In the opinion of the chair, the noes have it.
Mr. Chairman, I ask for a recorded
Mr.
vote.
Smucker has asked for a recorded vote, and the clerk will call the roll.
Mr. Doggett?
Aye.
Mr. Doggett votes aye. Mr. Thompson?
Thompson, no.
Mr. Thompson votes no. Mr. Larson? No. Mr. Larson votes no. Mr. Blumenauer? Mr. Blumenauer votes no. Mr. Kind?
I know.
Mr. Kind votes no. Mr. Pascrell? Mr. Pascrell votes no. Mr. Davis? Mr. Davis? Ms. Sanchez?
Sanchez votes no.
Ms. Sanchez votes no. Mr. Higgins? Mr. Higgins?
Higgins, yes.
No. I mean,
Mr. Higgins, what is your vote?
Higgins, no.
Mr. Higgins votes no. Ms. Sewell?
Sewell votes no.
Ms. Sewell votes no. Ms. Delbene?
Delbene votes no.
Ms. Delbene votes no. Ms. Chu?
Chu votes no.
Ms. Chu votes no. Ms. Moore?
Moore votes no.
Ms. Moore votes no. Mr. Kildee? Mr. Kildee votes no. Mr. Boyle?
Boyle, no.
Mr. Boyle votes no. Mr. Byer?
Byer votes no.
Mr. Byer votes no. Mr. Evans? Mr. Evans votes no. Mr. Schneider?
Snyder votes no.
Mr. Schneider votes no. Mr. Swazi?
Swazi, no.
Mr. Swazi votes no. Mr. Panetta? Mr. Panetta votes no. Ms. Murphy?
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez? Mr. Gomez votes no. Mr. Horsford? Mr. Horsford votes aye. Ms. Plaskett? Ms. Plaskett? Mr. Brady? Aye. Mr. Brady votes aye. Mr. Nunez?
Nunes votes aye.
Mr. Nunez votes aye. Mr. Buchanan?
Buchanan votes aye.
Mr. Buchanan votes aye. Mr. Smith of Nebraska? Aye. Mr. Smith of Nebraska votes aye. Mr. Reed?
In honor of Albert and thanks to my colleagues from Pennsylvania, I vote yes.
Mr. Reed votes yes. Mr. Kelly? Yes. Mr. Kelly votes yes. Mr. Smith of Missouri? Yes. Mr. Smith of Missouri votes yes. Mr. Rice?
Yes.
Mr. Rice votes yes. Mr. Schweikert? Yes. Mr. Schweikert votes yes. Ms. Walorski? Yes. Ms. Walorski votes yes. Mr. LaHood?
Yes.
Mr. LaHood votes yes. Dr. Wenstrup? Dr. Wenstrup? Mr. Arrington? Mr. Arrington? Dr. Ferguson? Dr. Ferguson votes yes. Mr. Estes? Yes. Mr. Estes votes yes. Mr. Smucker?
Aye.
Mr. Smucker votes aye. Mr. Hearn? Mr. Hearn? Mrs. Miller? Aye. Mrs. Miller votes aye. Mr. Davis?
Davis votes no.
Mr. Davis votes no. Ms. Plaskett?
Plaskett votes no.
Ms. Plaskett votes no. Dr. Wenstrup? Mr. Arrington? Mr. Hearn? Mr. Chairman?
No.
Mr. Chairman votes no.
The clerk will call the roll. I'm sorry, the clerk will report the tally.
What they call? Arrington's a yes. My apologies.
The clerk will suspend what would read.
Mr. Chairman, would you like to keep the vote open for Mr. Arrington?
How was Mr. Arrington recorded?
Mr. Arrington was not recorded.
Would you please have him?
Mr. Arrington, please read it.
Yes, Mr. Arrington votes yes.
Mr. Arrington votes yes.
Thank you, Chairman.
Will the clerk report the tally, please?
I have 23 nays and 18 yeses.
There being 23 ayes and 18 noes, the amendment is not agreed to. Are there additional amendments to the amendment in the nature of a substitute?
Mr. Chair,
Would you do that again, please?
yes, the tally was 23 noes.
23
and
noes.
18 ayes.
Okay, 23 noes and 18 ayes. The amendment is not agreed to. Are there additional amendments to the amendment in the nature of a substitute? If there are no further amendments, the question is on the adoption of the amendment in the nature of a substitute. All those in favor signify by saying aye.
Aye.
Those opposed, no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. Now let me recognize Mr. Thompson for the purpose of offering a motion.
Mr. Chairman, I move that the committee favorably report Part 3 of Subtitle E, Budget Reconciliation Legislative Recommendations relating to skilled nursing services as amended to the Committee on Budget.
The question is on transmitting the bill, Part 3 of Subtitle E as amended to the House Committee on Budget. Members are reminded to unmute themselves for the voice vote. All those in favor signify by saying aye.
Aye.
Those opposed, no.
No.
Aye.
No.
In the opinion of the chair, the ayes have it. The motion is agreed to, and Part 3 of Subtitle E as amended is ordered transmitted to the House Committee on the Budget.
Now that I ask for a recorded.
Mr. Brady has requested a roll call vote. The clerk will call the roll, and members are reminded that your camera should be on.
Mr. Doggett.
Aye.
Mr. Doggett votes aye. Mr. Thompson.
Thompson, aye.
Mr. Thompson votes aye. Mr. Larson.
Yes.
Mr. Larson votes yes. Mr. Blumenauer.
Blumenauer, aye.
Mr. Blumenauer votes aye. Mr. Kind.
Kind, aye.
Mr. Kind votes aye. Mr. Pascrell. Mr. Pascrell votes aye. Mr. Davis.
Davis votes aye.
Mr. Davis votes aye. Ms. Sanchez. Ms. Sanchez votes aye. Mr. Higgins.
Mr. Higgins, yes.
Mr. Higgins votes yes. Ms. Sewell.
Sewell votes aye.
Ms. Sewell votes aye. Ms. Delbene.
Delbene votes aye.
Ms. Delbene votes aye. Ms. Chu.
Chu votes aye.
Ms. Chu votes aye. Ms. Moore.
Moore votes aye.
Ms. Moore votes aye. Mr. Kildee. Kildee votes aye. Mr. Kildee votes aye. Mr. Boyle.
Boyle votes aye.
Mr. Boyle votes aye. Mr. Byer.
Byer votes aye.
Mr. Byer votes aye. Mr. Evans. Mr. Evans votes aye. Mr. Schneider.
Schneider votes aye.
Mr. Schneider votes aye. Mr. Swazi.
Swazi, aye.
Mr. Swazi votes aye. Mr. Panetta. Mr. Panetta votes aye. Ms. Murphy.
Murphy votes no.
Ms. Murphy votes no. Mr. Gomez. Mr. Gomez votes aye. Mr. Horsford. Mr. Horsford votes aye. Ms. Plaskett.
Plaskett votes aye.
Ms. Plaskett votes aye. Mr. Brady.
HR 4 is going to go up in.
Mr. Brady votes no. Mr. Nunez.
Nunes votes no.
Mr. Nunez votes no. Mr. Buchanan.
Buchanan, no.
Mr. Buchanan votes no. Mr. Smith of Nebraska. Mr. Smith of Nebraska votes no. Mr. Reed.
Because we really need to know enough
Reed,
to make sure
no.
that.
Mr. Reed votes no. Mr. Kelly. Mr. Kelly votes no. Mr. Smith of Missouri. Mr. Smith of Missouri votes no. Mr. Rice.
Whether or not they should gear up.
Rice, no.
Mr. Rice votes no. Mr. Schweikert. Mr. Schweikert votes no. Ms. Walorski. Ms. Walorski votes no. Mr. LaHood.
No.
Mr. LaHood votes no. Dr. Wenstrup. Dr. Wenstrup. Mr. Arrington.
Arrington's a no.
Mr. Arrington votes no. Dr. Ferguson. Dr. Ferguson votes no. Mr. Estes. Mr. Estes votes no. Mr. Smucker. Mr. Smucker votes no. Mr. Hearn. Mr. Hearn. Mrs. Miller. Mrs. Miller votes no. Dr. Wenstrup. Mr. Hearn. Chairman Neal. Mr. Chairman votes aye.
The clerk will report the tally.
Mr. Chairman, I have 24 ayes and 17 nays.
There being 24 ayes and 17 nays, the motion is agreed to. Part 3 of Subtitle E is amended, is ordered transmitted to the House Committee on the Budget. Without objection, staff are authorized to make technical and conforming changes to the committee print, and members have 2 additional days to file with the committee clerk supplemental, additional, or dissenting and minority views. The Ways and Means Committee stands adjourned.
Are we done?